If you've ever dealt with any gut issues, you probably know how hard it is to get a concrete diagnosis. Gastrointestinal diseases are difficult to treat because so many of them share the same symptoms, meaning doctors are often forced to slowly narrow down the options. Some conditions have a clear physical trigger, while others, such as irritable bowel syndrome, can be caused by anything from an infection to poor mental health. Dr. Megan Riehl is an associate professor of medicine and clinical director of the GI Behavioral Health Program at the University of Michigan. She says IBS is considered a disorder of gut-brain interaction.
So a patient with IBS has kind of like a ramped up version of the brain-gut axis. So sensations that are happening in the gut get sent up and signaled to the brain. The brain is focusing very heavily on what's going on during the digestive process. And this leads to impact on motility, so how fast or how slow food in the digestive process is happening.
And it can amplify pain signals, making it difficult for your mind to regulate the discomfort.
When we have those symptoms that are happening for people that have IBS, for example, the brain is very heavily connected to all of this. And really, our stomach is also thought to be our second brain based on this communication pathway. And it's a bi-directional communication pathway where, the gut is sending signals up to the brain and the brain is interpreting those signals and deciding what to do with them. And unfortunately, sometimes it turns them up and we feel those symptoms more intensely.
Since this gut-brain interaction is such a critical component to healthy bowel functioning, Riehl says medication isn't the only option patients have. Psychological interventions can be extremely successful in treating IBS. One that Riehl specializes in is called gut-directed hypnotherapy. Her new book called Mind Your Gut breaks down IBS management, including her use of hypnosis.
In our clinical work, there's no bell going off and clucking like a chicken. It's very different from maybe the stage hypnotherapy that you've seen at like your senior party or on a cruise ship. Medical hypnotherapy, going back to that concept of disorders of gut-brain interaction, actually utilizes very targeted protocols and suggestions to restore the way the brain and gut communicate.
Research for gut-directed hypnotherapy began in 1984. Since then, various studies and randomized control trials have proven that it's an effective treatment for disorders of gut-brain interaction.
We utilize a combination of focused thinking, guided body relaxation, and very specific suggestions about the functioning of your brain and your gut. And when we do that in this kind of protocolized way, we see patients have improvement in their GI symptoms, in their coping strategies, and their skill set,
as well as learning ways to fully relax their body. While it's probably a skill all of us should have, being able to relax is especially important for people with GI issues, since stress can worsen some conditions. Another big part of the hypnotherapy is bypassing the conscious part of the brain that does so much of the overthinking to speak with the subconscious. Riehl says the process helps remind it that there's no need to hyper-focus on anything because it already knows how to go through the digestive process.
We've become way too hyper-focused on this situation of, going to the bathroom or focusing very intensely on our symptoms. And so it is, in a way, speaking to the part of the brain to remind it, just like you know how to breathe without thinking too much about breathing, you know how to go to the bathroom. You know how to not heavily focus, which is called visceral hypersensitivity and visceral hypervigilance to our sensations that are happening in the body.
Riehl typically takes patients through 7 sessions of hypnotherapy over 4 months. Since the pandemic, the meetings are all virtual, so patients are able to be in their own home. Each one usually starts with a discussion about the patient's life in general before diving into the hypnotherapy. Riehl begins this portion by guiding a patient through a passive muscle relaxation.
If people have ever done yoga, and at the end, sometimes during Shavasana, you'll get walked through a passive muscle relaxation. So really kind of starting with something pretty tangible, noticing how your body is feeling. Then we do something called deepening, where I'll start to count from 1 to 20, and I'll use that count to start to give some imagery. So I might have them envision walking down a staircase or floating on a cloud, something to kind of start to draw their attention inwards and on my voice. all of the other life distractions start to kind of fade away as I'm giving you something tangible again to envision and imagine.
Which takes about 15 minutes. Riehl encourages the patients to use all of their senses. Feel the sun on their skin, see the wind move through the leaves, and hear the waves crash onto the shore.
And then we infuse some suggestions about the functioning of their digestive tract. So maybe something like if I've described a beach scene, starting to give suggestions about in the future, you'll pay no more attention to the sensations of discomfort in your stomach than you might pay attention to the waves crashing in the background on a beautiful day at the beach. And we discuss over and over different suggestions, different ways to address either pain sensations or motility sensations, catastrophizing about your symptoms, letting go of worry. And we infuse that in ways that make sense and kind of work together with the imagery.
Once Riehl reaches the end of her suggestions, she counts the patient back into the present. The entire process takes about 30 minutes, and though the patient is in a state of extreme relaxation, they always have full control over their body. In between these one-on-one meetings, the patients will listen to audio recordings at home each day to help practice the suggestions and muscle relaxation.
It's creating some habit and ritual in terms of self-care and stress management that even after you complete treatment, and research shows that once you complete treatment, you probably don't need to continue to do gut-directed hypnosis. But I always tell my patients, let's save that time. You've carved out that time for self-care and for relaxation. Your body needs it. We all need it. And so let's continue to utilize that time for your own self-care, whether it be using another relaxation app or using your own kind of imagination to do guided imagery or relaxation.
And if you have a flare-up in the future, you already have the tools to use as a coping strategy. However, Riehl says that hypnotherapy won't fix your condition if you also have unmanaged depression, anxiety, or history of trauma. She recommends to first address those mental health issues before moving on to your gut.
We want to prioritize your mental health first before diving into something like brain-gut behavioral therapy with somebody like myself. And so that's just, I think, an important caveat to consider in terms of the efficacy of these types of interventions. And then, once you feel like your mood or trauma symptoms are a bit more stable and the GI symptoms are maybe still there, then that's when you can really dive into this type of therapy.
Riehl's book, Mind Your Gut, is available now. You can find more information about Dr. Megan Riehl and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
Radio Health Journal returns in just a